video, we are going to talk about how to care for your body during pregnancy. How to care for yourself during how to care for yourself and your baby during pregnancy. Okay, so and I have 9 tips to stay healthy during pregnancy. 9 tips to stay healthy during pregnancy. So number one is eat healthy food. Yeah, eat healthy food. Healthy food is not eating anyhow or eating everything you see. Healthy food includes eating fruit, veggies, and drinking plenty of liquid, which is water. Yes, tea is not a liquid. Tea contains some substance. Okay, you eat healthy, you drink a lot of water, plenty of water, eat veggies, eat fruit. Okay, then and also you need to avoid some things. When you are pregnant, there are some foods you should not eat. There are some drinks you should not take. Okay, you avoid raw some food that contain raw, that some certain foods that contain raw, that are raw, like raw meat. Okay, because some of us, when we boil our meat, we don't boil it very well. And when you boil your meat or your chicken, eh, and it's not well properly cooked, it's raw. Okay, and it can cause some, it can be poisonous, it can be harmful to you and the baby. So make sure you cook your food, wash your food properly, your fruits, your veggies, your meat, or all of that, your chicken, you properly wash them. After washing, you make sure you parboil them very well. So, and also those drinks, you avoiding drinks doesn't mean you should and like abstain from them. You take them, but not too much, not overtaking them, like cola, Lipton, coffee. Yeah, you should take them like you should take them not too much. You should take, but not too much. It should be minimized. Okay, because caffeine is not good for baby. Yeah, breastfeeding mothers, I'm going to talk about that breastfeeding side, but let me say breastfeeding mothers and pregnant mom, caffeine is dangerous to your baby, because caffeine can stop baby growth. Caffeine can delay baby's growth. You see some, for example, now when you give birth to baby, you like, this baby is not growing, this baby, this you start complaining, like seeing some fault, seeing some, like some things from that baby. At times, it depends on what we eat during that pregnancy. Yes, at times it depends on what we eat during that pregnancy and during the breastfeeding, because whatever we eat, becomes whatever we eat is what the baby also take through breast milk. Yeah, the food we eat supply breast milk to the baby. The fluid we take, which is water and other drinks, supply breast milk for the baby. Okay, supply breast milk on your breast. Okay, so whatever you eat during pregnancy might affect the baby, and also whatever you eat during breastfeeding also do affect the baby. Yeah, because what you eat produce the breast milk. Okay, so now, and then thirdly, you should exercise daily. You take plenty of water, you do exercise, you walk out. Not doesn't necessarily mean that you do jogging. No, you can take a walk. Okay, you can take a walk because it helps you during delivery. It helps you and the baby, okay, for his safety and quick delivery. Okay, so you take a walk, and fourthly, take your antenatal medication. Take your antenatal medication. Go for checkup daily. Some of us do not. We don't go for checkup. We say, especially those that are already given birth before. They were like, it's not really necessary now. My first baby, I no go antenatal now. I no go antenatal. My first baby, I didn't go to antenatal, but I delivered my baby. No, first baby might be different from second baby. God gave you the grace to avoid antenatal, to skip antenatal during the first baby. Thank God. Then during the second baby, and you also want to try the same trick during the second baby, it might not work. Okay, so make sure you go for your daily checkup, take your routine drugs, exercise daily, eat healthy. You eat healthy, take your vitamins, take all the routine drugs that your doctors has prescribed or has then instructed you to take them daily and appropriately. Because baby needs those nutrients. During pregnancy. They need all the folic acid, they need the iron, they need the calcium, they need the mineral from you to grow strong and healthy. Yeah, it's very, very important. And also, fifth one, get plenty of sleep. Pregnant women, get plenty of sleep well, sleep very well, take a nice sleep, relax, sleep very, very well, enjoy yourself. Yes, because you are double. You are carrying so a human being in your womb. Because that baby needs, when you are sleeping, the baby also needs to sleep. When you are calm, the baby is calm. When you are doing a grigri, the baby is also doing grigri. So you take plenty of sleep. You sleep at least 7 to 9 hours every day. Okay, it's very, very important for your baby. Okay, and also, when you're sleeping, you sleep at the left side. Yes, you sleep at the left side. Okay, it's very important. It's good. It helps the blood flow. Okay, sleep at the left side, so because it's help the blood flow. Okay, and also you get moving. Now I've talked about the exercise. You do the exercise daily, you work out, you do some little house chore. Not really that you do all the jobs in the house. You have stress less. You can invite your loved ones to come over and help you. Then not that you sit down, Jabra. You sit down, you relax, everybody is there, you sit down. You not, if you want to lift your leg, you call somebody to lift for you. No, some women are like that. Not all women, some are like that. When they see someone helping them, they will relax during delivery. So you make sure, if you know you don't have the strength to do all the house chore, you invite your loved ones to assist you. Why you also do it? Because it's part of exercise. Okay, it's doing so. There's some house chore, walking around the house, doing some little things. It's also part of exercise. It helps you, it helps you, free your body. It makes your body flexible. Okay, it helps you. It makes your body. So it helps your body. Okay, and also, make sure you clean your breast. Yes, for 9 good months. 1 2 3 4 5 6 7 8 9. 9 good months. That breast has been like that. You can't scrub it with a sponge. Yes, you cannot scrub it because it's too hot. Okay, make sure you clean it. You can get a cotton wool with a warm water. Okay, you don't use cotton wool like that. You can't use ordinary cotton wool because all those this thing, the wool we stick on your breast. Just make sure you get a wet cotton wool, then you squeeze out the water. After squeezing out, you clean. Okay, you clean it. Awaiting your baby's arrival, you clean your nipple properly. You clean your breast very well. At least you clean for at least maybe if time permits, if you have the time, you can clean twice a week. You clean twice a week, because after delivery, this thing I'm saying, after delivery, you see, when feeding your baby, you see some particles, dark particles coming out, no coming out from your nipple, and baby will also take from it. So after feeding, you see it around your baby mouth. Then you'll be wondering, where is this coming from? It's coming from you. It's coming from you. So that is why you need to clean your nipple during pregnancy. That's the care we are talking about. You clean your nipple properly. When you are cleaning it, you will see it on the cotton. Okay, you see it on the cotton. So when you clean your nipple properly. You clean it properly. You make sure you eat healthy. You take your food portion by portion, not a big bowl. You put the whole rice. You take you cook one pot of rice. You dish out the whole one pot of rice. If they ask you, say, I'm two now, I'm eating for me and self and baby. No, when you eat like that, it will make it expand your tummy the more. It expand your womb, your stomach the more. You understand? So whatever we eat, whatever we take during pregnancy, after delivery, you won't be able to adjust it again, because that life has been in you. You understand? If you are lazy during pregnancy, everything you sit down reluctantly during pregnancy, when you give birth to your baby, the habit will still be there. Okay, because you won't be able to adjust again. Okay, you are lazy during pregnancy while the baby is still inside. When the baby is inside, you are caring, you care for yourself alone. Yes, you care for yourself. Okay, but when the baby comes out, you start caring for yourself and for the baby. So when you are lazy during pregnancy while the baby is still in the womb, when the baby comes out, what will you do then? You will not take bath the baby. You won't give the baby bath. You won't feed. You sit. Because so that is why we need to create habit of being strong. I know it's not easy. Yeah, it's not easy being strong while during pregnancy. So when you deliver, the agile will still be there. The strength will still be there. Okay, the strength will still be there. You still carry along with yourself. Okay, so all these tips are about caring for yourself during pregnancy. During pregnancy, this is what you should do. Okay, and also I understand that pregnant women crave. I was also a mom, so I understand we crave a lot. Pregnant women crave a lot. Okay, they need to take some. They feel like taking anything they see. They feel like eating whatever they see. They will say baby is pushing them to eat it. No, don't let your pregnancy control you. Try and control it. Okay, you are the one carrying the baby. I know it's not easy, yes, but try and minimize what you eat, how you eat them. Okay, minimize what you eat and how you eat them. Don't eat anything and anyhow. Don't eat it anyhow. If you want to eat, you take a portion of food. Portion. You can eat it like 5 times, but let it be portion. Small. Yeah, if you take it small, little by little, you can even eat it 5. But when you take it in a big bowl, you sit down, you are eating it, jam. You finish that one point, stomach, after delivery now, you cannot control it again. The afuku will be there. So, have mercy. You understand? So, if you want to remain the way you are, maybe you're a slim person, you're a medium person, you still want to maintain your stature, you still want to remain your sexylicious lady, so you need to cut some things during pregnancy and also after delivery. Because when you are breastfeeding, you eat more, because you say all the food you eat will go to the breast, will supply milk. So you eat little for yourself, and you eat food that can supply milk for your baby. Okay, you eat the one that can sustain you. Okay, and also eat the one that can like supply, that can, the one that can sustain you, that can sustain you, and also supply milk for the baby. You understand? Not eating too much, saying after I'm breastfeeding I need to eat very well. If I don't eat very well, I'll be feeling lazy. No, you eat, you can take it portion by portion, not too many food. If not, this, your tummy will be, you will expand, your stomach will become, will expand. And also, you know, some after delivery, after like 6 months, yeah, 6 months, after 4 months, the mother will start becoming no fat. You start having some, plumpy body, you start becoming fat. So then you need to, that time you need to start cutting down some things you take. You need to start cutting down some food, some drinks, some things you take. You can have your baby, and do not go to the gym. You can deliver your baby, and you will not step your foot in the gym to shade that fat. Okay, so that, to avoid going to the gym after delivery, you need to start working on yourself during and after delivery. Hmm? I hope these tips help someone out there. Hmm. Yeah, I hope this tip helps someone out there. So this is all I have for us today. So next time we will still discuss about our mom. Yeah, we'll still discuss more about this. Okay, so this is all I have for us today. This is all I have for us today. Just stay tuned. Stay tuned. Take care of yourself. Have plenty of sleep. Drink plenty of water. Stay healthy for yourself and baby. Okay, it's very important. Hmm? Thank you so much. Thank you for watching. Thank you so much. Thank you for watching. Bye.